So this is my 4th year doing a talk at Mountain Meadows, and I just want to say thank you all. Every year I know more and more people in the crowd, and that's because many of you have trusted me with your physical therapy care, and I really do appreciate that. I love working in this community, and I love each one of you that I've met, and so I appreciate the ability to come and speak to you all. When I asked some of my current patients and past patients, what should I talk about this year? Overwhelmingly, the response was balance. And my first year speaking here, that is what I talked about, but this is going to be a little bit different today. We will get into some of the science, behind balance and what causes us to remain balanced. But we're also going to do some demonstration and some testing with each other. And try to figure out how you specifically can build your own balance routine that is geared towards some of the issues that you may have with balance, or just to prevent having issues with balance. So that's what we're going to talk about today, as well as get into some fall prevention. I have some handouts to give everyone for that as well. And you may have noticed that a small detail on this slide has changed from the previous 3 years. I did marry the love of my life in June, and I now have a very cool name for someone who likes to climb mountains. So, however, I do not slackline. But I think when we talk about balance, we tend to think about people who are exceptional at it. Athletes, people who do ballet, people who dance, people who do gymnastics, you name it. Yes, they do have exceptional balance. However, each and every one of us has a very active and working balance system, even just keeping you upright and sitting today. And so there are ways that you can focus on improving balance that are fun, such as yoga, Tai Chi, and some other exercise routines. And it's not all just standing on one leg. So I've had some patients say to me, well, I can't even stand on one leg anymore. And that is a measure of balance, but there are many other measures of balance, and that's what we're going to talk about today. So it wouldn't be a talk by me if we didn't talk about some science. And while balance is a very complex body system, and a huge portion of that comes from our brain centers that control it, there's also some peripheral balance organisms that we have as well. And so we're going to talk through all of those things, but mostly the things that we can have an impact on. So if you're taking notes today, I want you to write down 3 words: vestibular, vision, and proprioception. So if that is a word that I think gets thrown around a lot, hopefully today we can clarify what it means, what is proprioception, and how is it important for our balance. But if it is a new word for you today, stay tuned. We're going to get into what it means and how it impacts our balance. So when we talk about the vestibular system, we are talking about the inner ear. Vision is extremely integral to balance, and then proprioception is what particularly your feet and ankles are telling your body about where you are in space and what kind of surface you're standing on. We have them at other joints as well, we'll get into that. But as it relates to balance, we're very interested in the foot and ankle system. So when we talk about the vestibular system, or the inner ear, I like to point out how closely related to our organs of hearing the vestibular system is. You can see that this is our vestibular apparatus. I like to see it as a snail, because it kind of looks like a snail. We have our main hearing bones that conduct hearing that are attached to the vestibular system, and then our cochlea, which is our main organ of hearing. All of those attached to our vestibular system and are innervated by the same nerve. So that's your cranial nerve number 8, and it is called the vestibulocochlear nerve. And you can see in this diagram, it's coming in from the brain to innervate both hearing and vestibular or inner ear balance system. One of the cool features of the vestibular system are the semicircular canals. Those canals are filled with both fluid and small crystals called otoconia. I think of them as a level. So if you have a level and you're trying to hang a picture and get it level, you're looking for that bubble to be right in the center. And that's kind of what our semicircular canals do for us. That fluid moves when we move our heads. So if we turn our heads, look up, look down, that fluid and those crystals are moving seamlessly to keep me balanced. I did not lose my balance. I didn't have any visual disturbance in doing that. So my vestibular system is working. The other very important portions of that are better visualized in this diagram. That's going to be our utricle and saccule. So that's that little portion there, that the snail's face, basically. And that's the same. It's going to respond to your head change positions, your eyes and where they're moving, but it also responds to gravity. So if I bend forward, take my head down, or if I bend backward and look up, the reason I didn't fall over is because, again, my vestibular apparatus is working well. It's also going to respond to position changes like standing up, sitting down, getting out of bed. So anytime that your body is moving through space and impacted by gravity, both systems are keeping you balanced and keeping your vision focused straight ahead. And I should also mention, if you have experienced hearing loss, then a lot of times hearing loss goes hand in hand with a vestibular or inner ear issue because they're so closely intertwined and innervated by the same nerve. Often if a person has hearing loss on one side, they might also have some vestibular loss on that side. It doesn't have to go together, but a lot of times it does. And so we kind of talked about that the vestibular system primarily responds to body system or body movements, body position changes, especially head position changes. But it also keeps us balanced when things in our environment are coming or moving toward us. If you're walking through a crowded shopping center, mall, festival, and there's lots of people coming toward you, you can keep a sense of where you are in space and where your eyes are looking if your vestibular system is working well. When people struggle with vestibular issues, then a lot of times those things can throw them off balance, and they tend to avoid crowds or crowded grocery stores, similar to riding in a car or a plane. Your vestibular system is hard at work keeping you centered and balanced while the landscape is moving or the vehicle you're on is moving and your body is maintaining balance. Internal changes, which we talked about, sit to stand, also turning over in bed, and even when vision is removed. So we're going to come back to that, but I have a lot of patients who have said to me, I can't really close my eyes when I'm scrubbing my hair anymore. That throws me off balance. Again, that's your vestibular system that is supposed to be keeping you balanced, even when your eyes are closed. And we'll talk about why that gets more challenging as we get older. So, in summary, the vestibular system is really important to keep us balanced, and it works with our visual system, our spatial orientation systems, and another piece that I wanted to mention is our autonomic nervous system. So when patients come to me and they complain of when I'm sitting for a while and then I go to stand, I get really dizzy, sometimes that can be a vestibular issue, but sometimes that can be a blood pressure issue. We call that orthostatic hypotension, meaning your blood pressure drops with those types of position changes and it drops enough to make you dizzy. Well, that's another system that our vestibular system interacts with. And so if you have orthostatic hypotension, you've probably learned to be very slow with those types of movements, getting out of bed, getting up from chairs, and that's why. But another question that I've had as I've worked with an older adult population is what specifically changes in the vestibular system as we get older? Because we know our skin changes, we know our bones change, we know our muscles change, many things change, but why do we naturally lose balance? I've had patients who have climbed mountains and rocks and skied and done many feats of extraordinary balance their whole lives, but still face the same issues when they get older with, for no good reason, my balance is changing. It's becoming more of a challenge for me to stay balanced. Well, a vestibular reason for that is in those organs that we talked about, inside the semicircular canals and the other organs of balance in the vestibular system, we also have hair fiber cells that interact with the fluid that I mentioned. That senses that fluid changing and moving. We lose some of those hair fibers as we get older, and that's just a natural aging process. The second thing that happens is the vestibular ganglion, or the neural interface, which this is a decent diagram of. That can also deteriorate with age, meaning that even if you're getting input from the nerve, your vestibular system is responding more slowly to that input. And so those two reasons are things that we really can't control. That just happens as we get older. And so then that does lead to an increased fall risk. And we're going to talk more about some other factors that can lead to that as well. So I'm not going to get deep into pathology today, but I do wonder, has anybody ever experienced acute vertigo? So room spinning dizziness with position change, and it comes on suddenly, and you don't know what caused it.
I was drunk.
Unless you were drunk. So I specialize in treating vestibular conditions, and that's one thing that I used to see in clinic a lot before I took my practice out into people's homes. I got lots of referrals for vertigo. And basically what happens, I think it's a design flaw, but who am I to argue with evolution? However, when the fluid, the otoconia is suspended in the fluid, like I said, and it's supposed to move through the canals and tell you when your head is changing position. But sometimes those crystals can get stuck. And when they do, imagine if there was something blocking your level when you're trying to see if your frame is aligned, then that bubble's not going to move. Well, that's what happens to our vestibular system, and then our vision goes crazy, and that's why the room spins. It's called nystagmus. It can happen for many reasons besides just BPPV, but that is a very common reason, and that's something that physical therapists can treat. It's our job to kind of figure out which canal is it coming from, and then we do a series of head movements to reposition the crystals, which sounds like woo, but it's true. That's what we're doing. And that can help the patient get better a lot faster. So that's one of the vestibular issues that can cause obvious, acute dizziness. Vestibular hypofunction means one side isn't working as well as the other side. Like I said, sometimes that can be tied to hearing loss. Meniere's is a very severe form of vertigo. If anybody's ever experienced that, that's not something that PTs treat. Sometimes that's even treated by surgical intervention, but that can be bouts of vertigo that last for even up to hours. It can cause vomiting, nausea, it's not fun. And so then, of course, we have things like strokes that can impact the blood flow to some of these systems. But as we move into speaking about vision, one thing I wanted to point out is with concussion and or a corresponding whiplash injury, there can be a disturbance to the muscles that attach on the upper cervical spine that are impacted by a whiplash moment. And those muscles control our eye movements. And so sometimes, well, quite often, when a patient has had severe enough concussion or whiplash injury, I will also see associated vertigo. And so that's how closely intertwined that our vestibular system is to our neck and to our eyes, and that's what we're going to get into next. Just a plug for vestibular PT. If you have any of those conditions, for the most part, you will probably see a physical therapist, and that's one of the populations I really enjoy working with, and other colleagues of mine as well. So moving into vision. Okay, we talked about eye movements and how important they are to, when we move our eyes, our inner ear has to keep us balanced. And so those two systems, they function together. If I move my eyes, generally that also means my head is going to follow. My vestibular system is keeping me balanced. There's muscles that control that, and like I said, they attach on the upper cervical spine. So all three of those systems, your neck, your head, eye movements, and vestibular system, they are working all the time to keep you able to look down at your notes and write something down and then look back up at the screen and not feel dizziness. Okay, so no matter what, no matter how old you are, if you're a kid all the way up to an aging adult, visual input is one of the most important components of balance. And I'm going to demonstrate that in a few moments. But as we age, we become even more reliant on our vision to maintain balance. And so this is just a plug for what you can do to prevent falls. If we know that about ourselves, then we just need to have light. If you're getting up in the middle of the night, some people have these really cool canes that have lights on them that can light the path, but you should have light when you're getting up in the middle of the night. You're undergoing a significant body position change. Your vestibular system is trying to figure out where you are in space, and sometimes just turning on the lights can really help. So that's one plug for what we can do to prevent falls. Does anybody have any questions so far? I thought I saw one. Yes.
Why is there nausea often accompanying these vestibular issues?
It's the nystagmus piece, like the rapid movement of the eyes. It interacts with the autonomic nervous system and just makes you feel extremely nauseous. Most people get nausea, and some people even throw up when we're doing the vestibular treatment. But it's the same reason why people get, motion sick on planes or boats. If your body is moving, or your brain thinks your body's moving because your eyes aren't able to focus, then it tends to induce nausea. But yeah, it's an autonomic response. The brain starts to freak out. Why can't I see, and why is the room spinning? So, yes.
Does seasickness, is that the same thing? I mean,
Yeah.
it's moving.
Yes, that is, seasickness is often associated with a hypersensitive vestibular system. So the system may be working well or too well, or it may be struggling to compensate and understand where your body is in space on moving body of water. So yeah, that's directly related to the vestibular system for sure. Okay, so as we move into our big word of the day, proprioception. We talked about how they're mostly found in the foot and ankle, but they're also found in other weight-bearing joints. So if you've ever done a push-up, a plank, if you push yourself up from a chair or a surface, your wrists and your shoulders also have proprioceptors, and their job is to tell your body, here's where you are in space, here's the kind of surface you're bearing weight through, and whether or not that changes. So if you're walking across carpet and then suddenly you hit the tile, if your vestibular system, your proprioceptive system, everything is working well, you're not going to sense that. That's not going to bother you. Your brain may note that, but it's not going to throw you off balance. But if you struggle with proprioception or vestibular input, a lot of times that is enough to throw somebody that they have to use an assistive device in their home. So changes like that are things that our proprioceptors are supposed to be very sensitive to. And when they lose sensitivity for whatever reason, the most common cause is neuropathy. And in my earlier career, we talked about that as mostly being present in a diabetic population, but as more people are aging and developing idiopathic neuropathy with no known cause, sometimes it can be a medication side effect, sometimes there truly is not a known cause. But that is the most common proprioceptive, specific loss to proprioception. It's not just proprioception, it's other sensation in the feet too. But other than that, you can also have arthritis in your feet, you could have had joint replacement surgeries in your foot, ankles, history of fracture or ankle sprain, and all of those things can compromise your proprioceptive feedback coming from your feet and ankles to your brain. So we're going to get more into, I brought some toys with me, we're going to demonstrate how to challenge proprioception. But I did want to point out some of the things that we have available to us in the fitness center. The Bosu ball, so I brought a smaller version of that, but there's a bigger one in the fitness center. It has a ball side and a platform side. I will demonstrate both. We have a balance pad, just a soft cushion. And then there's also the tilt board, the side to side. And then I think we also have a couple of the discs, the yellow and the blue, that are just a really narrow plastic disc you can stand on. And all of those things challenge your proprioception. When we move from solid ground to something unstable, then the proprioceptors are working overtime. Okay, so some other influences on balance and equilibrium, flexibility, especially of the feet and ankles, strength, we're going to get deeper into that. Our gait speed, we have a lot of correlations in our literature to as your gait speed, as your walking speed slows as you age, then your fall risk and your fall risk increases and your balance decreases. So that's something we're starting to study more, incorporate into treatment more, as we're working with people who are at risk of falling. And then we've talked about some of the disabilities, illnesses that can influence balance, as well as we've talked about some age considerations. But if you're taking notes, then there are 3 more words I want you to write down. One is, or I guess groupings of words, base of support, surface, and vision. So we've already written down vision, but this is in a different context. And that's what we're going to focus on next. So one more sort of definition before we get into demonstration. We're going to talk about static versus dynamic balance. So static balance is what we're practicing mostly when we're on surfaces like this. Our body's ability to remain balanced when the body isn't moving, but the base of support might be moving. Vision is compromised, or proprioception is compromised. So if you're thinking with a physical therapist brain and you're trying to challenge a person's static balance, you first need to know what is it that they struggle with. And then once you do, you can start altering these components. So base of support would be where my center of mass is over my feet. And if you see people who have had cerebellar brainstem pathology or stroke, sometimes they can be said to walk with what's called an ataxic gait, so kind of really wide base of support and forward moving by laterally kind of weight distribution, I guess. And if you watch young kids as they're learning to walk, we typically will see that too. Their base of support's really wide, and they have what we call a high guard stance where their hands are up in the air because they're learning how to be a biped. And so, you know, in those cases, that wide base of support is giving them some stability from the ground up for their center of mass. But if we're trying to challenge balance, then we're going to start narrowing that down, and we're going to talk about what that would look like. Before we do that, though, we'll talk about dynamic balance briefly. So great to have good static balance, but the most important thing is when we're ambulating and moving, can our body keep us balanced when things are changing in our environment? And obvious challenges to dynamic balance would be the ability to navigate obstacles in your path. I had a cat that tried to trip me this morning right before my balance presentation. I was like, well, thanks. But yeah, pets are often an obstacle, and just, you know, clutter in your environment, that type of thing. And then just a moment to appreciate how much our bodies do for us, how much our brains do for us that we don't even think about when we're ambulating over grass, over changing surfaces, whatever that looks like. If you like to hike, or even if you're just walking across the parking lot, our bodies are taking in constant information from the ground up, and there's constant communication with all of the systems we just mentioned. So, all right, so these are the things that we wrote down. How do we improve our static balance? Well, we want to challenge what we struggle with. So I'm going to demonstrate. I don't know if you can see my feet. I want you to pay attention to what happens to how hard my feet work when I am in a compromised base of support, or if my eyes are closed. So first, if I bring my feet together, I'm fine. If I close my eyes, I'm fine. If I now take one foot and put it in front of the other foot, if you can see, my feet are working. But I'm staying upright, I'm fine. I'm balanced. My right leg is my weaker leg, so it's in the back. It's not going to keep me as balanced as when my left leg is in the back, and then I'm not working quite as hard. Now, if I were to close my eyes, okay. And when my eyes are open, I'm not looking at my feet, but that's how much our vestibular system relies on vision at all. Once I take that away, now my feet are freaking out. They're trying to give me extra information, which actually isn't all that helpful. Now, if I stand on one foot, what's working? Right? If I change feet, I'm fine. But if I close my eyes, see how hard my foot is trying to tell me I'm okay. Okay, so for me, a person who's 41 years old, a trail runner, a hiker, a person who does a lot of things to challenge my balance, I can do those static positions and be okay. That's not going to challenge me enough. So I will need to vary my surface. Now, if I'm feet together, eyes closed on an unstable surface, oh no, that's hard. See, this is like, all my patients are like, see, I told you this is hard. Same with eyes closed, tandem, right? I need to have something to hold on to. And then if I try that in a single leg, well, now we're really working. And I want you to work on the concepts that you wrote down. So how can I narrow my base of support? Trying those 3 different positions. If you're on solid ground and you're already struggling, that's a really good place to start if you're building a routine for yourself. And then can you challenge your vision? Can you close your eyes? What does it look like if you do? And that's sort of a good starting point. Okay, well, when I close my eyes, that's really, really challenging. Then when you're at the fitness center where the balance equipment is set up, there's a bar there that you can hold on to if you need it, and you know where you can start from. And then you can start to think about, okay, can I use some of these other tools to make it even more challenging? Because the whole point of challenging balance is it shouldn't be easy. If I can stand here on one leg all day long, I'm not challenging my balance very much. But if I close my eyes and put myself on a Bosu ball, now I'm making some of those systems that should be working at a high level for me. For example, if I'm trail running, I'm challenging those systems in a more relevant way. And so that's what we're looking for. So we're going to take a little break from me talking. And
Can I ask a question?
yes,
Some of us have vision issues,
Yes.
so we don't have to close our eyes to have vision problems. I have one eye that doesn't work very well. Perception is very challenging.
exactly.
So I'm already starting with a handicap.
Yes, and that is a very important point that people in an aging population do tend to face macular degeneration, cataracts, glaucoma, retinal detachment. There's so many different issues that can compromise the visual system, but since we know we're so visually reliant for balance, then you can keep your eyes open, and that's totally fine. Just maybe think about varying surface or base of support if you want to try to sharpen your vestibular system to work harder for you, and your proprioceptive systems to work harder for you, since you know your vision is compromised. But it takes no fear to try, right? Like you have to be okay with this is going to be uncomfortable. So does anybody want to volunteer to go first and be my demonstrator? And let's test your balance. Thank you. That is much better. Okay. All right, so this chair is here if you need it.
Sure.
So I'm going to have you face them. Look straight ahead. Don't look down, please.
Okay.
Okay. Can you bring your feet together? All right, can you let go of the chair?
So I can't feel my right foot, so that's a little difficulty to see when my foot is together. Anyway, what?
Can you remove your hands? There we go. Now hold that. And can you close your eyes? He's been practicing, by the way. But you can see, some of the little trunk corrections that your body kind of overcompensates. That's normal. That's nothing to be afraid of. When we see significant trunk compensations, that's where we encourage a lot of holding on at first.
I'm cheating. I'm opening my.
All right, let's try one foot in front of the other.
What?
One foot in front of the other.
Okay.
You choose.
Okay.
There you go. Okay, now look straight ahead. It's a little bit harder for him. His right foot is in the back. And remember we talked about the weaker foot in the back. It makes it harder. Let's try closing your eyes. He falls to the left, and that's because he trusts his left side more. Okay, go ahead and open your eyes. Hold on. Let's switch feet. Okay. Can you look straight ahead and remove your hands? Good. And can you close your eyes? Yeah, so it's definitely harder for him. Okay, you can go ahead and put your feet back to normal. There you go. And so if a person is already struggling with that on the floor, we're going to start there. He and I have been practicing a lot with the pad, but we may not go all the way to single leg stance. We may just start right there. So hopefully that gives you guys some inspiration to try. And same, pick a neighbor to help you. You're guarding them, you're helping, and they have some confidence that they can at least try to close their eyes. Chairs right in front.
Helps if they're lighter than you too.
It does.
Yeah.
Yep.
One other thing, may I?
Yeah, sure.
Just wanted to point out in our sessions, I do the circuits on the machines, and I've noticed that my balance sessions with Steph, I can only last a certain amount of time because I get so exhausted to try to compensate for what I'm doing. And so it's kind of amazed me since I've been working out with you that how tired I can get doing that. It's that connection that hopefully there's enough of a connection, but the connection between your brain and your foot. Yeah. So
Good. Well, thank you, Chris.
yeah, thank you.
Does anybody else want to try?
Now, I've been doing this kind of thing for years, and it doesn't seem to be getting better.
Okay.
So what's that? Okay, so what do you want me to do first? Okay, I'm okay standing like this with my eyes closed. Mostly, okay.
Okay.
Yeah.
Pretty good. And then how about one foot in front of the other?
Yeah, now if I have, this is my weak foot,
Okay.
and if I have that behind, then I'm really not balanced at all.
Okay.
Okay.
Yeah, let's change feet.
Oh yeah, the other foot's much better.
Wow.
Yeah.
You're right. Very good. Okay, can you stand on one foot?
Well, yeah. This foot, which is my stronger foot, I can stand on for a few seconds, no problem.
Pretty good.
This one, it's not, which is my weak foot. Now, see, I'm already down.
If you step off a curb, do you have a foot that you?
I have my cane.
Oh, that's how I broke my finger.
Oh, really?
So, yeah, so, and close, I haven't even tried to close my eyes with this, cause I just can't not, yeah.
Okay. So yeah, there's a number of things that we could try to make it harder, but still within your limits.
Okay.
And that's what I would say is like, if there's something that you feel like you do really well, then what's the next thing that you can progress yourself to? So like, if you can if your right foot behind you is really challenging, but your left foot's not, can you close your eyes? Can you do it on a surface like this? But it does seem like the right side just needs that continual piece of proprioceptive work to rebuild that, since that's your weaker side.
Yeah, okay. So just keep doing it.
Keep doing it, and don't be afraid to continue to progress yourself.
Okay.
Try harder things. Just back. And so because I really want everybody to feel like they could go to the fitness center and try some of these things on their own and come up with something that could help them improve their balance. Okay. So we've talked about some principles of how you can do that, right? Narrowing your base of support, challenging on an unstable surface. But I want to get into muscle strength because there's lots of literature out there that talks about, strength is good for balance, strong legs and core help you with balance, et cetera, et cetera. You'll find articles to support all of these claims. And what we're finding out as we go into our data a little further and, larger research pools, bigger studies, is that it's not just muscle strength that we're looking at. It's actually muscle power. And so what is the difference? So if I'm testing someone's muscle strength, just in a very rudimentary way, but I say, try to straighten your knee, don't let me push you back. And, I can't break the person. I cannot. Their quad is very strong when I'm testing isometrically. That's what I mean with muscle strength. Their quad is not necessarily weak. If I say lift your knee, I'm testing their hip flexor. I can't break it. Okay, they have a strong hip flexor. That's true. But that doesn't speak to how quickly can they recruit that quad and that hip flexor to catch them if they're going to fall. And so what we're finding is when we're trying to design programs for older adults for fall prevention, just getting them strong may have some benefit. But if we're not working on that speed, rate of firing, contraction, and we're not even testing it to know that that's an issue, then we're only getting so far and we're still seeing people fall. So in a study that was most recently published in 2022 in the Journal of Biomechanics, it was kind of looking at all these systematic reviews and all the data we have for strength and why we're not really seeing a good translation to strong older adults and lower fall risk. And so that's kind of what they were positing, is that it's not just the ability to be strong, it's the ability to respond quickly. And so that's sort of the data that they're getting into to prove that it's really our muscle power that matters more so than just strength alone. And so when we're talking about that, we want to know, well, how does this functionally translate? At least that's what a physical therapist's brain goes, okay, great. But what does that mean for the patient? What am I looking for? What are they supposed to be able to do that would indicate whether or not they're at risk for falling? And what we've been able to correlate in the literature to longevity, fall risk, quality of life, independence are these four major factors, although there are others. Grip strength in and of itself, ability to stand from a chair without use of hands, ability to get up from the floor without assistance, and then our gait speed, which I would love to do a whole separate lecture on and why that's so important. We're not going to dive deep into that today though, but what we're going to do together, whoever is willing and brave, I'm going to show you how we test for muscle power, okay, when it comes to the ability to catch yourself from a fall. How can we quantify that? So this is called the 5 times sit to stand test. It's exactly what it sounds like. I'm going to demonstrate first, and if you have an iPhone or a phone that has any sort of timer, alarm, or clock, there's usually a stopwatch in there as well. Or if you have a watch, you can also time your neighbor that way. And so we've looked at normative data. I pulled the data for that's most representative of this age group that we're testing today. And these are averages based on age and basically predictive of fall risk or the need to assess further and see, is this something we need to work on? So the way that you do the test, when I say go to myself, I will press the start button. I'm testing how quickly I can stand all the way up and sit all the way back down 5 times. It doesn't count if you just go halfway up and halfway down. You have to go all the way up and all the way back down. But when we start to lose that power from our muscles, then we start to see these times increase. Or people have to use their arms, or can't really stand all the way up, or have to have an assistive device in front of them. And so all of those factors we take into account if we're doing this test and if I'm working with somebody. Okay, everyone, that was great. Saw lots of people testing. And Donna brought up a very important point. If you have some arthritic pain in one of your joints, that may skew the outcomes of the test. It may not mean that you don't have good muscle power. It may just mean you have arthritis and it hurts. So there's, that's not a test that I would choose to use with somebody who has that kind of an issue. There are other ways we can test. But this is just the most functional way. And if you've ever been to PT and you've needed to work on strength or balance, you've probably had a physical therapist tell you to do sit to stands. That's why. But if you're still doing that as an exercise, which is a really good functional exercise, maybe think about challenging yourself with speed. If you don't have a joint complaint, that would prevent that. Because that's a way to build that muscle power and that reactive ability. Okay. So almost done today, and this we're just going to briefly talk about because I have handouts for everybody. But because I am a physical therapist that comes to the home, I do get to have a unique eye into how patients that I work with live, what their home environment is like, how it looks when they're using assistive devices in the home. And one of the best ways to prevent falls is to address your home environment, because that's where falls occur most frequently. At home, either getting out of bed or getting up or down from the toilet. So in the bathroom and bedside, those are the most common places that people fall. Barring a cat trying to trip you, like mine did this morning. But yes, pets can be a problem. They can get right under your feet, right under your walker, right under your cane. And so these are just some very basics. They are covered in these checklists, but the biggest thing with flooring that I notice is that people have lots of throw rugs, but if you're using a walker in your home, that is a barrier to your walker. So you either need to have a way to have it adhere down to the floor, or you just need to pick up throw rugs, especially in the kitchen, because when you're cooking or doing dishes and you're going from cabinet to cabinet, especially if you're using an assistive device, you really don't want to think about, okay, where are my rugs? Okay, where is my pot? You want to be able to do that seamlessly without your environment fighting you. I have been in homes where the patients say, well, I did adhere it down, but their rug is like this high and it's still in the walkway. And that's, still very easy for your foot to catch or your walker to catch. And so I always just tell people that's the first thing you can look at that can prevent a fall. We talked about lighting. Most of our homes that I'm aware of here in Mountain Meadows don't have stairs inside. And then one nice thing about stairs that I've found in working with some patients recently is most of the stairwells here, in fact, I haven't found one yet that doesn't have a rail on both sides, which makes it a lot easier to use your cane to get up and down stairs, because you can have one hand on the rail, one hand on the cane, and you can choose which side you're going up or down. So I just included that because it's on the checklist. I know most of us aren't considering that in our home environment, but there are stairs here at Mountain Meadows, and relatively they're pretty darn safe if you can navigate them with a cane. And then grab bars are something that people don't often think about, but they should be in the bathroom. If you use an assisted device, you should have them by your toilet, in your shower. If you can't stand for the duration of a shower without feeling like you're losing your balance, you should have a shower chair. So those are things you can actually order on Amazon now. And they're relatively easy to access, whereas before you kind of had to use a pharmacy or a medical supply place. Kitchen, you don't want to have to use a step stool or a ladder in your kitchen. Things should be, if you're going to use them a lot, they should be right where you can reach them relatively easily. And then we talked about rugs, but you should also be aware of clutter, cords. I've watched a patient that I worked with get up with their walker and take their iPad and iPhone cords along with them and not even know that they were doing it. So you just want to be aware of those types of things. And and sometimes it's hard to see in your own environment, but inviting a friend or a friendly physical therapist in to have a look, second set of eyes, and maybe they can point something out that you can't see. So, like I said, I have those handouts here, and if these run out, we'll make some more copies and have them available at the fitness center. But I have spoken for long enough. Does anybody have questions? All right, and then Mitch, do you have a working microphone? Yay.
Yeah, you mentioned grip strength.
Yes.
How does that impact on balance?
So that's a good question. And there's a whole set of data to suggest that as a person's grip weakens, that's a big indicator of overall functional strength. So sometimes that can be directly related to having had a hand surgery, and that's something that you can rebuild. But once that starts to be something you're losing idiopathically without really a reason, then that is a predictor of your overall functional status. And if I was a PT working with you, I would take that data, but then I'd also look into other bigger muscle groups with some of these other tests and see if that correlates. Good question. Yes.
I've got two questions.
Okay.
The first one is, what is the relationship of, well, let me put it this way. As we get older, we tend to bend over more. My partner's always telling me, stand up straight.
Yeah.
And does that have, what effect does that have on balance?
That's such a good question. I love it. Okay. Think of your head as a bowling ball. Okay? Most people's heads weigh 10 to 15 pounds. So when we're talking about your base of support, you're thinking like maybe waist, core, where is it over your feet? But we also have to think about where is our head over our feet. And if you're displacing a bowling ball size head forward beyond your center of mass, then your body is now not only having to keep you upright in all the ways we mentioned, but also having to balance for, to use a physics term, a longer lever arm, right? So like if my head is over my shoulders where it should be, then that weight is nicely stacked through my cervical curve here, and then over my thoracic spine ribs, and then over my pelvis and lumbar spine. So that's a good, if bipedal design is good, that's good. And the only reason I say that is because I always wonder when I'm hiking at the mountain goats that just prance up the side of the cliff like it's nothing. But yes, so if you have two legs, you really want everything to be stacked and centered over your feet. And if it's not, then that really presents a whole new challenge for your body and brain to compensate for. And then I think you had one more, is that right?
Yes. What about footwear? I mean, some shoes now have very soft and they kind of wiggle around a little bit, or then there are flat soles. So which is a soft, cushy sole better for practice, for getting balance, or is a flat sole better?
That's a really good question. So it always depends on the individual, right? So if you have neuropathy or diabetic foot issues or anything that compromises your sensation, ideally you're in a lot of shoe, right? Like you have some cushion because you can't always sense when you're stepping on something that might be sharp. But that's really the only reason that, and if you have pain, right? If you have arthritic feet or a lot of pain, then having extra support and cushion can be helpful for that. Otherwise, you should be in shoes that give you a wide toe box, and there's only a few brands out on the market that allow for that. For so many years, we've been in shoes like this that narrow you in at the toes, but that doesn't allow for your feet to really sense well where they are in space. It predetermines them to not be able to splay like they're supposed to, which helps you stay balanced. And what I find a lot of times is when my patients wear too much shoe and they have a balance issue, it makes it worse.
Yeah.
And I've actually experimented this in myself. I used to wear really thick hiking boots with tall, ankle supports. But I started wearing ultra shoes that are minimalist, zero drop, with some traction on the bottom to hike in. What I've noticed is, wow, I actually am getting so much more feedback when I step on rocks, I can make quicker adjustments because I can feel. And then when I try to go back to hiking boots, it's kind of like learning to hike all over again. It's not easy. And so Hoka's were out there in the market for a while, and physicians were really pushing them because of the cushion. And if you have an orthopedic foot issue, sure, the cushion is great. If you're a runner and you're a heel striker, having some extra cushion there is great. Otherwise, I found that shoes like that are just such a wide platform and so thick that it really just it's working against the person's proprioception ability. They're not feeling what they're supposed to feel from the ground because they're having to feel through so much shoe.
So you're saying a softer shoe is actually better for regular things?
Yes, a softer with less of a sole, like more of a minimalist design.
That's what I find these kinds of things to be very, I call them, they're not tennis shoes, what do you call them? Slippers.
Yes.
Slippers. Like tennies, I don't know what you call them, they're tough shoes.
Right. I mean, there's all
I can
kinds
feel
of
myself, I can really feel,
Yes.
anyway.
bare feet are the best, aren't they?
Bare feet are best.
Not if you have high arches, because you could pronate it.
If you don't have foot issues, that prevent you from enjoying that comfortably. But yes, you're right. I mean, that's where that research comes from, is the more our feet can give us feedback, the better our proprioceptive systems work. But we all have our individual issues. Some of us have high arches, some of us have collapsed arches and need the arch support that a shoe provides. So it just depends on your individual issue. But if you don't have feet issues, a more minimalist design that allows you to really splay your toes when you're walking and doesn't bar you from getting that feedback from the ground up is better. We wrap it up today.
How much are your shoulders involved in falling? My husband was a quadriplegic and he fell out of his wheelchair a lot, but he had really strong shoulders. He would grab it. He didn't have control of his legs, but he could get to a chair or his car even. He fell out of the car when he was driving. I'm not what you're saying. But anyway, he was using his shoulders and his arms.
Yeah.
Well, originally he was really strong, and he used a regular chair at first. But somehow our use of our shoulders or arms are involved.
Very, very important. So the ability to do like push-ups, the ability to use the machine at the gym where you're pushing down with your triceps, the ability to do dips, those types of things. When a person loses their legs in particular, that's what they'll work on almost exclusively in physical therapy, is developing that shoulder and arm strength. And so that's another piece of it. You're absolutely right. We talked a lot about leg strength today, but we didn't really mention that how important the arms are to being able to get yourself up from a chair, from a bed, from a very low chair, or even from the ground if a fall should happen. So that is very important. Yes.
I found that it was very very much harder to have somebody try and help you get up.
Yeah, and sometimes when I teach getting up from the floor, I do observe, some other patients can testify to this, but I kind of observe how they would try to go about it first, and then offer feedback or advice, based on their particular issue if something's working against them. But it is one of those natural skills that we tend to unlearn as we lose flexibility and strength. But I mean, how many times do children fall and get back up? And it is one of those things that should be automatic. And so that, you're right, like that's usually what I do first, is how would they go about it?
I find it's much harder to get up with somebody trying to help you
Yeah.
than just turn over and get up with your knees.
Yeah, and some people need just the external assistance, right? Like they could get up as long as they have something to push up from and they just need that. So it kind of depends on the person. All right, well, thank you guys so much for coming out. I really appreciate it.